Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Nathan Kusterer, who is a cardiologist with Baptist Health. Welcome.
Thanks for having me.
Now, I said atrial fibrillation when we started the show. What is it?
I'll probably call it AFib just for short moving forward, but it's irregular heartbeat or heart rhythm, an arrhythmia. The heart has 4 chambers, 2 atria on the top, 2 ventricles on the bottom. And in AFib, the atria, instead of having a nice organized contraction, are kind of disorganized, quivering, jumping around. So it's a pretty common problem. About 5% of the U.S. population has it. It gets more common as we get older, especially after age 60, age 65. So a lot of people out there probably know a family member or friend that deals with this.
It's on TV a lot. We see a lot about it. But how do you know you might have it? What kind of symptoms does atrial fib cause?
So in some people, they're pretty attuned to feeling the irregular heartbeat, so you can feel the heart racing or going fast, sometimes in situations where it otherwise shouldn't be if you're sitting resting. People may feel sort of new onset shortness of breath, dizziness, lightheadedness. Sometimes it'll cause chest pain or a feeling of sort of anxiousness. Probably the most serious symptom of AFib that we worry about is there's a risk of stroke with AFib, and sometimes, unfortunately, the first time that someone finds out they have AFib is after they suffer a stroke or a mini stroke.
Now, we're going to come back to the stroke area, but how do you know, when do they need to come to see the doctor? What do you do to make the diagnosis of AFib?
I think with any of those symptoms, or if you've sort of noticed you can't quite do the things you used to be able to, and it seems like it's sort of changed suddenly, that's a reason to come in and get checked. We can diagnose it with an EKG. Some people go in and out of AFib, so sometimes it can be a little hard to catch it. So we may ask you to wear a Holter monitor, which is like a longer-term EKG. It's a stick-on monitor that you can wear for a week, 2 weeks, sometimes even 30 days. We have, if we need to, some monitors that can be implanted under the skin on the chest that actually can give us a way to watch someone's heart rhythm for years. And then we do use sometimes some at-home devices, like trying to catch things on an Apple Watch, or you might have seen the Cardia mobile EKG devices. Those are somewhat accurate in trying to catch it when it comes or when you're feeling symptoms.
So if you get to the doctor, you got a diagnosis, how do you treat it?
There's a few different things. So for the tendency for the heart rate to run fast, we have a couple of medicine groups that try to slow the heart rate down, try to keep it more regulated. Those are called beta blockers or calcium channel blockers. Then we have some other medications called antiarrhythmics. They try to keep the heart in what we call a normal sinus rhythm, try to keep it from going into atrial fibrillation at all. And then if you need to escalate things, we can do a procedure called a cardioversion, which is a timed shock of the heart using some external pads that tries to get the heart back into rhythm. And then people may have heard of a procedure called an ablation. That's actually done internally with a catheter inside the heart that applies either some electrical signals or some heat energy that tries to break the atrial fibrillation circuit.
All right, now you mentioned as one of the side effects is stroke. So how do you prevent, blood thinners, and there's a new thing called Watchman. Tell me about how that plays into it.
Yeah, the standby has been blood thinning medications, so some that people may have been familiar with on TV, Eliquis, Xarelto. There's Pradaxa, an older medicine called warfarin. They basically try to keep the blood from stagnating in the atria. When the heart isn't beating quite as fast as it should, it doesn't quite empty out all the way, so it's almost like a pooling or a puddling. The blood thinners try to help the blood platelet cells from sticking together and forming those clots. But with blood thinners, there is the risk of being more prone to bleeding. And so there's been development of these devices that we call left atrial appendage occlusion devices. There's one called Watchman, there's one called Amulet. they're actually put in, similarly to the ablation idea, internally inside the heart. I almost think of it as like a little manhole cover that you put over the appendage. You stop blood flow from getting in or getting out, and that's a way to prevent the clot formation and prevent the stroke.
It's an outpatient procedure.
Yeah, most patients go home same day. At most, may stay one night, but predominantly outpatient procedure.
And works equivalent to blood thinner or as well?
Yes, they've shown that it's effective at preventing stroke, and it's a really good solution, especially if you sort of get into that rock and hard place where you want to prevent stroke, but somebody's maybe had a bleeding ulcer or prone to falls or injuries, and you want to avoid trying to stay on a blood thinner for a long time. And it's become more and more commonplace to utilize those.
Right. It's great information. Again, thanks for the care you give, and thanks for coming in.
Yeah, no problem. Thank you.
We'll be right back.